CTV News with Michael O'Byrne and Leanne Cusack.
In just a few minutes, you have access to Sherry Torkos' expertise. She's a holistic pharmacist who has written the Canadian Encyclopedia of Natural Medicine, a book designed to enable you to take charge of your wellness. Sherry's prepared to tackle questions on any disease or condition. Today, she's here to talk about a few subjects you don't normally bring up at the lunch table, some of the unspeakable and uncomfortable elements accompanying one of life's most joyous experiences, pregnancy. Good to have you here.
Thanks for having me.
And of course, now everyone's going to want to know what the unspeakables are.
Well, there's a lot of good stuff, of course.
Lots
of good stuff. But sometimes pregnancy can bring about, well, there are hormonal changes and there are certain discomforts that can occur during pregnancy. The worst for a lot of women is the morning sickness. The nausea, the vomiting, the queasy stomach. Sometimes women crave certain foods and all of a sudden dislike other foods. Now, I guess if we could start with the nausea, because I brought something for nausea, and this funky piece of root here.
Ginger root.
That's ginger root, right. And ginger is great for nausea, and it's actually safe to use in pregnancy.
And it's also great for anyone who has digestive
That's right.
upset.
Digestive issues, or if you have motion sickness. You'll find ginger in this prenatal supplement. This is by FemMed, and it's a prenatal formula with ginger. So you get all the benefits of the prenatal supplement, which are the antioxidants, the vitamins, minerals. The reason a prenatal is different than a regular multi is it has increased amounts of certain nutrients like folic acid, which is important to protect against neural tube defects, spina bifida. Really critical that women take that before and during pregnancy.
Now, a couple of weeks ago, there was a concern that people may be getting too much folic acid.
I've read more studies showing that we're not getting enough than we're getting too much. And the other nutrients that women really need to boost up is their calcium, their magnesium, also iron. Because when you are pregnant, there are increased demands in your body for the minerals, calcium and iron. Calcium, of course, is essential for the formation of the baby's bones and teeth. And if you don't have enough in your diet, the growing baby will start to take it from your own supply, and you can actually suffer bone loss. So a good prenatal supplement like this one here can really help to make sure you're getting all those essential nutrients.
The second topic on your hit parade.
Yes.
Hemorrhoids.
Hemorrhoids, yes. Not fun when you're pregnant.
Sherry said that with a great big smile. Oh, it sounds so different when you say it with a smile.
But there's good news. There's things we can do about it.
And this doesn't only apply to pregnant women, but when women are pregnant?
Yeah, when women are pregnant, they're at increased risk because they're carrying extra weight. There's extra pressure going on that area of the body. Anytime you have extra pressure on the rectal area, people that stand for long periods of time or sit in a chair in their office for a long period of time are at increased risk of hemorrhoids because you've got all that pressure going down on the rectal area. One idea is to get a donut. You can find those in the pharmacy. You know those rings? They're called donuts, and you can sit on them if you're sitting down, or they can help provide support.
And then everyone at the office will know you have hemorrhoids. No, but it does, so it takes the pressure off.
It's being proactive, absolutely. And also making sure you're not straining when you're having a bowel movement, whether you're pregnant or not, making sure you're getting enough fiber in your diet, because if you get constipated, the straining with constipation irritates hemorrhoids. Basically, a hemorrhoid is an enlarged vein. It's similar to a varicose vein, only it's occurring in the rectal area versus in your legs.
But you can with more fiber and,
more
just make
fiber,
more water in your diet, probably.
Avoid constipation. And if you do get a hemorrhoid, baking soda and water, or having a sitz bath, there are different creams that can be used, and a lot of things that are safe to use in pregnancy as well.
Okay, next, you even alluded to varicose veins.
Yes, varicose veins. Again, same reason women get them in pregnant as the hemorrhoids. They've got extra pressure on their legs, their extremities. The veins can dilate, they can enlarge, twist, and bulge. That's a varicose vein. Best way to prevent that is to wear support stockings. And support stockings are not like they used to be 20, 30 years ago. They're fashionable. They don't look like grandma's stockings. They're amazing in terms of support.
You make everyone feel great. The donut cushion, the support stockings.
But they do make a huge difference. It's incredible. I have recommended them to people that work on their feet all day, say cashiers that are working in a store. They really help to increase blood flow back to the heart and prevent pooling of blood in the extremities.
Okay, all great advice.